Oh, now it is. Is it going? Yeah. Hi, my name's Jessie. I'm with the outpatient clinic today. How are you?
Good. Nice to meet you.
Nice to meet you. What's your name again?
Terry.
Terry. Hi. So what brings you in to see us today?
I'm just coming in. I was hospitalized a couple months ago, and they just started having me come in weekly to talk to someone, so that's why I'm here today.
Okay. How do you feel like you're doing since your hospital stay?
I feel like I'm doing a lot better. I was hospitalized for depression and suicidal thoughts, and I feel like they got my medications figured out, and I'm not having as much trouble with that. But when I was here, they kind of talked about diagnosing me with COPD, so I've had a little bit of anxiety from that. But other than that, I think I'm doing a lot better than when I was here last time.
Okay. So you were recently diagnosed with COPD.
Yeah.
Are you a smoker as well?
Yes, I am.
Okay. That can impact COPD a lot. Would you mind if we talked more about your smoking?
Yeah, that would be okay.
That's okay? Okay. Just tell me some things about it, tell me about your smoking. How many cigarettes do you smoke a day, or what are your habits, just so I have an idea of what's kind of going on.
Yeah, well, I started smoking probably when I was 13 or 14. I think it was just kind of a peer pressure thing, and then wasn't ever able to quit, and now I probably smoke 1 to 2 packs a day. But yeah, that's probably, normally I smoke, kind of anytime I'm in the car, I'm normally smoking. After I eat, I normally have a cigarette, so those are kind of, habit-wise when I'm smoking.
Okay. So you say you smoke 1 to 2 packs a day, and it's mainly after eating or in the car. Do you ever smoke when you get, feel anxious? Does it help you calm down or anything like that? Yeah.
Yeah, that's one of the reasons that I don't really feel like giving it up, just because I feel like it's really helping with my depression and anxiety,
Okay. Well, from what I've heard, do you have, how does it affect you, any signs that you've noticed that are different from,
since
recently?
I got diagnosed with COPD? I kind of have, cough. I've had it for a really long time, especially if I get, laughing or I'm really hot, it gets really intense, and it's kind of hard to make it stop.
Okay.
And, really anytime, I used to run a lot, and now I can't really do that. I mean, even walking a short distance, I get, it's really hard to breathe and stuff, so that's kind of what I've been dealing with most recently.
Okay. Well, from what I've heard you say, those are all things that can go along with COPD and the smoking. And from the amount you tell me, the 1 to 2 packs a day and how often, I'm concerned because it's above a safe limit. So that's one thing that concerns me and can really affect your health and the COPD diagnosis. Would you are you at a point where you think you could consider quitting? I mean, what are your thoughts on quitting?
No, I mean, I don't really want to quit right now, or even really, try to plan or think about quitting. I just feel like I had such a hard time with the depression and anxiety and stuff that I don't really want to take on that challenge too. I feel like smoking, helps keep me calm and is really helping to keep me in a good place, so I don't really want to go back or try to work on quitting right now.
Okay. Well, from what we've talked about with your depression and you coming in, and it seems you seem to be doing a very good job with that. Yeah. And I really think that we can find other ways to help you cope with, you say that the smoking calms you down, and the anxiety factor of it really helps calm you down and it keeps you from getting depressed. But I feel like there are other options we could try that will help with that besides smoking. How do you think smoking affects your daily life?
In negative ways?
Yeah, what are some ways that you kind of wish you could change, but because you smoke, it's...
Yeah, well, I feel like it's not really a big deal to me, it's not really, harming me. It's more when other people are kind of around me, they're always, making comments. I know it really upsets my family, just because of the health risks associated with it, and, like I smell. I can't really smell it because it's
Right.
on me or whatever. But when I get around my family, they're always making comments about I smell like cigarette smoke. And I have a sister that has a daughter, my niece, and she just doesn't really like me being around her because of the smoking. Doesn't want me to smoke around her and stuff like that. So it kind of interferes with our relationship and stuff. So.
Okay. Well, from those things, those seems like you could use those to kind of help motivate you to try to quit smoking. I have this readiness ruler,
Mm-hmm.
and after kind of talking so far, where do you think you would stand? It's 1 to 10, 1 being you are just still not ready to change, and 10 being I'm ready to make a change. Could you tell me where you kind of feel like you're at right now?
I think I'm probably like at a 2, I would
2?
say. Yeah.
Okay. Why a 2, and how come not like an 8 or a 10? What are your thoughts?
I think it's just because of the depression and anxiety. I don't wanna quit right now because I've had such a hard time with that, and I feel like I'm doing well, so I don't want to like tip the boat any. I just
Okay.
kind of want to keep it where it's at.
Just
so.
to kind of keep that depression out of the way.
I don't want the added stress of trying to quit. I think it would be hard for me right now.
Well, that fear of kind of falling back in depression is very understandable, and I feel like we could try some other options too that may help. What can you tell me some pros and cons maybe that we could try to work through that would give me some pros and cons of how like quitting would affect your life? So pros, you said kind of like your niece, correct? You'd get to hang around with her.
Yeah,
what are some other
get
ones?
to be with her more. I guess really at this point, because of the COPD diagnosis, I would, if I quit, that would help with that a lot.
Mm-hmm.
Be able to breathe better and stuff like that.
Okay.
I wouldn't smell.
Mm-hmm.
All my clothes in my car and stuff would be nicer, so
Right.
it's kind of a pro. But I think health would be the biggest.
Health. That's a good one. What about some cons? Are there anything that you think you would struggle with if you quit?
I just think that I would, like when I got anxious and worked up, I wouldn't know what to go to help calm myself down because it's always been cigarettes. So I think that would be my biggest, fear about quitting.
Okay. Would it be okay if we kind of talked about some goals? Maybe if you got to that point where you're wanting to quit, we could kind of set up, and that way you have an idea of what to kind of look at later on down the road if you feel like you're ready to quit.
Yeah, I mean, that would be okay, but I don't know if I would use it. I mean, we could set it up, but I just don't know if I would
Okay.
do
Well,
anything with it.
so you say you smoke 1 to 2 packs a day. How do you think you could cut back on your smoking in your daily life? What is something that you could maybe shoot for to try to help you cut back?
I think, like, realistically, maybe I could try, to not smoke after, like, one meal. Like, I don't think I could do not smoking after every meal, but, like, or maybe try not to smoke one of the times that I'm driving somewhere. Like, I don't really know if I could cut back on a certain number. I think certain number of cigarettes, I think that might be kind of hard, but maybe just try the one time of day not to do it.
That's a good step. That is a perfect place to start, and baby steps are the way to go, especially with something so difficult of a habit to quit.
Yeah.
That would definitely be a good thing. Do you think what are some other things that you'd be willing to try with that? I mean, cutting back on the amount of cigarettes you buy, or cutting out, like, say, a morning habit or something like that, would you be interested in, or is it?
I mean, I might. I don't know about right now, but
Okay.
I mean, those are a couple ideas of some things I could do, but I'm not sure.
Okay. Well, those are all, like you said, very good steps, and the pros and cons are great reasons, and I can understand completely why you want to, but you're hesitant to, especially with that depression and anxiety with it.
Mm-hmm.
But I would like to, if you want, is to set up another appointment and kind of see where you're at in a couple weeks. Would you be okay with that?
Yeah, I'd be okay with that.
Okay, well, here's my card. We will kind of get together, and you can just make an appointment, and we'll kind of... I'd like to continue talking about this if you're willing to at a later date, just to kind of see if your thoughts have changed or anything like that.
Okay, that sounds good.
All right, well, thank you for meeting with me, and hope you have a great day.
Yeah, thank you.